Abdul-Malik Abdul-Latif is my name. I'm a Ghanaian studying for an MSc in Health and International Development on the Chevening Scholarship. I am a yearly fellow of the African Changemakers and a fellow of the Institute of Development Research. I am a public health practitioner with a background in nutrition and a Master of Public Health degree from the University of Ghana. I've had the opportunity to serve rural populations in the most remote places of Ghana, from the level of a district nutrition officer to a district director of health services of the Ghana Health Service. In these capacities, I have led and managed teams to design and implement health interventions aimed at improving access to primary health care, whilst also improving child health, adolescent health, and maternal health outcomes. And all these have been done in partnership with community leadership, the academic community, NGOs, and international organizations like WHO, USAID, Mary Stopes International, and many others. I've also consulted for Population Services International and World Vision International. Having served in the Ghana Health Service for a couple of years, I've come across situations of needless and preventable deaths. The causes of some of these deaths are multifaceted and simply cannot be resolved by the health sector alone. How do you guarantee the health of people when they lack basic water and sanitation, when they are not covered by insurance, even though Ghana has a comprehensive national insurance scheme? So there was a need for me to really understand these challenges from a development point of view. I realized I wanted to understand global politics, economic growth and redistribution, and its impact on public health. So I started searching and I came across the HEAD program, and it stood out among all the international development programs that I came across. I thought the models were great, and I wanted to also study in the best school in the world, and that's the reason why I came for this particular HEAD program. I must say I'm very impressed with what I've studied so far, and I can't wait to start impacting society with the skills that I've acquired.
Project?
My dissertation is about power and politics in health policy making. About a year ago, the government of Ghana rolled out an intervention against public outcry that uses drones to deliver essential medicines to health facilities, especially those in hard-to-reach communities, as a strategy to save lives by reducing the rate of medicine stockouts. So my dissertation is trying to understand why and how the drone intervention became a national priority and its effect on the health system. The study shall look at how policymakers understood medicine stockouts such that drones were thought to be the logical solution to the problem. So I shall be looking at how the intervention got onto the agenda setting stage and prioritized over other interventions, even though it wasn't part of the plan of work of the Ministry of Health. So I shall draw on theories from political science, such as social construction theories, power, and then agenda setting, to answer these research questions. And I'll mainly be conducting interviews with some key stakeholders who will be able to speak to the issues to collect enough data to answer this research question. Enrolling in this course has been a life-changing opportunity for me. The interdisciplinary nature of the program has not only deepened my knowledge, but has also expanded my understanding of the issues of development, the relationship between economic growth, poverty, and health, and how the framing of health programs is much more crucial in mobilizing funding than the burden of disease. I now understand how to critically consume literature, and that's something that is part of me now, and it's very beneficial for my academic development. Yeah. I would say it's a Geneva trip. It's an activity that I really looked forward to, and I was more than impressed when we went to Geneva. I learned a lot of things from the presentations that were made by the organizations that we visited. We had some networking opportunities, and I made a lot of contacts, and that have even proven to be very useful. I was supposed to have done an internship this particular summer in Geneva with the Global Fund. Unfortunately, COVID came to disrupt everything, and that's another key thing that happened in this particular year. In fact, COVID has really tested the robustness of health systems all over the world, and even for countries that were thought to have a very weak health system have surprisingly been able to manage the COVID situation better than even countries that have very good health systems. So I think this is an area that students can do for their dissertations or even a PhD topic. The HIT program is quite demanding but rewarding, and I feel that my value has increased immensely as some jobs have started coming my way. My advice to incoming students is that they should focus on their goals and select courses or modules that would help them achieve those goals instead of courses that are easier to pass. For instance, I went in for the consultancy module because I needed it to get me into the international development space. I just didn't do it because it was quite demanding, but it was quite rewarding for me. The second advice is that they should be able to go through the preliminary readings. It's very, very important. I didn't do so, and I struggled during the first few weeks, but I managed to catch up somehow. The third advice is that they should be able to form study groups right from the start of the course, because the readings are quite demanding, they are quite bulky, and it's practically impossible to be able to go over them by yourself. But if you have a team, a study group, is easier to be able to manage the readings. So I wish you good luck. I know you are going to have a very good time going through this program. It's been an amazing journey for me, and I wish you the very best. Thank you. Bye-bye.